morning. Nice to see you. Colorful.
Recording is not.
Other day we had Telangana Orthopedic Association meeting here. It wasn't so colorful. Respected dignitaries on the dais. Leena, she is the key for successful nursing education in SVS. SVS nurses are there everywhere. If you see any corporate hospital, they come and say, sir, I am from SVS. Probably you know, we received a certificate or you attended our function, our annual day. So nice to see, makes me very proud. And it's all because of Leena's leadership and our team. Thank you very much for excellent work. And especially, I think we were thinking to organize such a meeting for a very long time, but not yet. I think after looking at you, I think we should do soon. As she said, AI will not replace nurses, that's a very good word, but it will replace any medical profession without knowledge of AI. If you're not going to use the technology, especially AI, we're going to be extinct. And Dr. Ajit, I think I'm just talking to him, he's a surgeon. Very nice to see you in SVS. Thank you very much for coming over. And principal, very dynamic principal, our Dr. Joshi, and my brother Ram Reddy Garu. All the faculty, delegates, all the supporting staff, audiovisual. Thank you very much for coming over and going to be a very successful meeting. I keep saying every time, nurses are the backbone for the healthcare. We are able to get the results because of you, because of your hard work. When patient comes to my clinic, the first person to see is a nurse. They will record vitals, BP, whatever, come to me. And most of the time, they're quite comfortable because when they come to a doctor, they're very anxious. When they come and see you before they see me, they're already reassured. You must say, okay, don't worry, doctor is going to talk to you nicely, he's a good person. And half of their anxiety or problem will go down. Other day, one of the patient came, sir, thank you very much for putting a nice nurse in front of your clinic. She told me many things, reassured me because he's coming for surgery. And what we do, we consult, we do the operation, and I spend maybe, how much? Not much time. 90% of the care is given by you. Pre-operatively, during the operation, and post-operative care. I come once, do rounds, and probably give instructions, but the rest of the time, you look after them. But unfortunately, you are not able to spend so much of time with the patients because of other commitments, paperwork. Probably AI is going to help you. As Leena said, AI will go after all this paperwork, all the documentation, rest of the whatever management work. You spend most of the time because spending time with the patient makes a big difference. To know about the patient, what is their occupation, where they come from, what is their family background, what are their hobbies. If you know about them, they will be very happy. So nurse is very interested in my family, background, business, whatever. They feel very happy. And they feel very homely if we spend more time with them and discuss their family, personal things. So it is very important. Your profession is a noble profession. Without your profession, we are nowhere. The results we are able to achieve because of you. So you should get better every day with the technology. Technology is there. If you don't integrate technology, you will disintegrate. we've been using AI, artificial intelligence, for so many years. First time navigation we used in 2009 for a knee replacement. As you know, routinely we do knee replacement, hip replacement with robotic surgeries, and it makes so comfortable. A recent study has shown the stress of surgeon has gone down significantly after introduction of robotics, because you know what's going to happen and you know you're going to achieve a reasonable result. You're not going to come across any surprises during operation. Even surprises, you have the help in the operation theatre. So your stress levels will come down significantly for a surgeon. Okay? Very helpful. Initially, I was very reluctant to use robotics because I did not understand. Probably I was ignorant. Once you know about it, because any hobby, any game, any toy, if you don't know about it, you don't like it because you don't know how to use it. Once you know smartphone, once you know what are the uses, how you're going to enjoy, I think that makes difference. So now previously probably 10-20% are robotic surgeries, now 90% are robotic surgeries. In the beginning we used to spend 2 hours to do a robotic knee replacement. Now it's about 30 minutes because of the training, and the training is very steep. You learn very quickly because unlike any other machines, robotic machines, because every day it changes and it will adapt to yourself and to the patient. One example, knees, the knee implants are made for Americans or Europeans, but with the robotic surgery we can do knee replacement designed for that particular patient. Whichever fits the best for that particular patient, we can do that. So this is all individualized service. So with the robo, we can do surgery which is suitable for that particular patient. It's not uniform for everyone. So it is precision and it's defined for that particular patient. And with the robotic surgery, what happens is pain will be less, incision is less, we cut less, and we know what we're doing. There is a system called haptic feedback. That means when you're doing surgery, if you're not doing what you plan or what is the right thing, it will stop. Robo will stop working. There will be red alarm that you are crossing safety zones or you are not doing what is planned. So there is a haptic feedback. You can assess yourself where you're doing the operation in the right way or not. Previously it wasn't there. Our eyes used to say, okay, this may be right, this may not be right. But there was no way of assessing yourself on the table during surgery. We used to know afterwards, taking an X-ray, seeing the patient. But now with AI, it is possible to correct yourself on the table. And that makes a big difference. So the scope for errors are minimized significantly. But it's not going to replace you. It's only going to help you, especially in the nursing care. Recently there was an incident in Apollo Hospital. One of the nurse gave by mistake anti-diabetic drug to diabetic, excess dose. Patient went to hypoglycemia, convulsions, brain death. It's a big disaster. There is no way you can explain or justify that's medical negligence. So drugs, using a drug, it will, if we take AI help, it will prevent such complications. Previously we used to remember the dose, how many milligrams. Now you don't have to remember. Of course, you have everything on the smartphone, but with the AI you can decide on the spot. Previous exams, we used to say, what is the dose of so and so drug. You don't have to remember now, because you have to check. The current criteria is, if you're giving any drug, you have to check with 2 people, 2 nurses and 1 doctor nurse, imprint of the patients, and confirm that's the right drug, right dose, right person. And this will help in reducing the human errors. And also, notes is the biggest thing. Most of the time, we cannot or you cannot read what you've written about few years ago. But nowadays, documentation have become so perfect. Documentation is the key for a successful research, publication. So much data is there. So if you document, it will analyze, it will tell you what is the best way of looking after a patient, or diagnosis, treatment, result, anything, side effects. With a touch of a button, it will tell you everything. And you can publish so many papers which will help you improving patient care. So I think very fortunate to have this AI conference here. We have our MRI scan is AI assisted. Previously, MRI scan used to take about 40 minutes. To do brain scan, it takes 7 minutes. To do children in the past, we have to anesthetize. Anesthetist will say, boys, machine, everything they have to do the MRI machine and do the MRI. Now there is no need. Because of the AI technology, we can shorten the duration. Without anesthesia, we can do MRI in children. And so many things. So, technology is there to stay, whether you like it or not. And I'll repeat again, it is not going to replace nurses. It's only going to replace nurses without AI knowledge. We are very proud of SVS nurses. Hope you are going to be the best in the world. And my request, don't leave the country. Stay in the country. Serve the people. Because there is severe shortage of nurses in many hospitals, even SVS. We're training so many nurses. Your services are very important. At least 10% of you stay back in a couple of years, we would be very happy. Thank you once again. Thank you for your invitation.